Brad says, Thomas, did you say there was a medication you found helpful for depression and anxiety? I'm suffering with it at the moment and considering medication. I think medications it's a difficult one. A lot of people have a lot of different thoughts about it, but I mean, first I think it's important to consider that, you know, medications do come with some very noticeable side effects for sure. That's one thing. I'm not a doctor, just by making that clear, but in my own experiences, I found that particularly with antidepressants, SSRIs, selective serotonin reuptake inhibitors, that they do tend to reduce my overall depression, but sometimes it can, depending on the dose and depending on which medication I go for, it sort of raises up my level of anxiety at the same time. It's something that I've talked to Dr. Temple Grandin on my podcast. They were talking about how they've sort of managed their anxiety, and she suggests that a lower dose is good for autistic people. Obviously, it's going to really depend, but in my experience, I haven't found an SSRI that I can tolerate as so far as managing my depression, but also not skyrocketing my anxiety too much. I've tried a few. I've tried fluoxetine, I've tried sertraline. When I say tried, I mean I've been on them for multiple years with my doctor's supervision. The one that I've landed on is citalopram at the moment, and that seems to be the one that I can tolerate the most, and that isn't too bad for me. But even then, even with the citalopram sort of being sort of the most tolerable to me, I do have to take another medication that helps me with my anxiety, which is mirtazapine. I think it's worthwhile being aware of that. It may not be the case that antidepressants do cause you to have that level of anxiety. For a lot of people, a lot of the reasons people use SSRIs is to both reduce anxiety and depression. Or some people just use it for depression even. So it really depends on what your neurology is, but it's kind of hard. It's hard to tell sometimes because you obviously have a ramp up period of about 3 to 4 weeks, which is pretty awful. And then as well, you become tolerant to it. So if you wanted to go off it and then try another one, or just go off it and just not have it, there's going to be that period of time which is very, very difficult. And whenever I've been off antidepressants for a significant amount of time, while I've been trying to wean myself off, my doctors have usually prescribed something like diazepam to help, because the anxiety can just be really, really intense. And your depression symptoms can also be heightened for some people. You know, I'm talking about the negatives because I think it's important to highlight them, because I do talk a lot about how medication has benefited me in terms of my mental health, but when I talk about the positives, obviously people, you know, so highlight it and say, oh, it's not good to be on those things, those are bad for you, they're addictive. Well, they are addictive, you know, chemically addictive, you know, you have withdrawals if you don't have them. So it's worthwhile pointing that out. But I do find it does tend to, if anything, it sort of stabilizes my mood. So it makes the dips in my depression a little bit easier to cope with, but it can also sort of remove this kind of, I don't know, the magicalness, the spice of life, if that makes sense. It sort of flattens out the dips a little bit, makes them a bit more tolerable, but also flattens out the positives a bit. So I don't feel like I can get as excited about things. I don't feel as I can feel as positive as I would be able to if I wasn't on them. And that's useful because it can sort of stabilize you a fair bit. And they have shown in studies that it can often help with like productivity and work and stuff. Particularly if you do have depression, and sometimes for anxiety too. I mean, it's a difficult one because there's different types of antidepressants as well, isn't there? There's like the typical ones, which are your SSRIs, which are the ones that I talked about, citalopram, sertraline, fluoxetine or Prozac. And then you have like classical, I think of like tricyclic antidepressants, which are usually prescribed when SSRIs don't do a good enough of a job, or for like pain and stuff, because there's some other side effects to them. Then you got other ones which act on different things. There's one called bupropion, which also acts on dopamine as well as serotonin. I've heard from a lot of people that that's been quite helpful for them, especially also if you have difficulties with the old nicotine. That's something else that you can sort of consider. I think it's best for people, I think, from thinking back to my university lectures, for atypical depression. A little bit different to regular old major depression. So I'd think that the best thing to do is to really talk to your doctor, and if possible, try and see a psychiatrist that specializes with autistic people, or at least consult somebody who has experience with it, because it does really depend on trial and error in a lot of cases. It's worthwhile trying out other things. I'd say that if you are in the very tail end of severity of depression, it might be something that you're on for a while, like myself. Try other stuff, try lifestyle changes, exercise, like a little bit of meditation, not like a massive amount. In general can do a lot of help. Keeping up with water, just the basic all boring stuff. And I mean, for me, you know, I went for a long time just solely relying on exercise, but it just wasn't really enough for me. But it might be for you. I mean, it's something that I encourage anyone to do who is, or just in general, but also specifically autistic people, because it can really do a lot to regulate you. It's kind of like a blanket approach to anxiety. You know, when I was talking about that video about alexithymia, I was talking about sort of blanket methods, just general things that you do on the daily that sort of reduce your anxiety, perhaps boost your mood a little bit. I mean, we can get into a whole discussion about big pharma, and you know, there's so many like conspiratorial related things around medication, so it makes it quite hard to talk about it plainly. But yes, they can be really beneficial, but and they can save lives in a lot of cases. It just really depends, you know. You gotta be aware that if you decide to go on them, it's going to be a task. And then if you decide to come off them, it's going to be even more of a task. Probably been on meds for about as long as I was diagnosed with depression. It wasn't just like went in there and they were like, okay, you have depression, and gave me meds kind of thing. I was in a very severe state, shall we say. Not doing the best, couldn't really keep myself safe at that age. And so that was something that they suggested. I think I was about 14, but I've been on them ever since, and I've had periods of time where I haven't been on them, and a lot of the time it can be great, and I can feel really happy, and you know, I can experience that excitement and sort of the spice of life to a certain degree. But in the same vein, if I go through a low period and I'm not on my antidepressants, it's really, really bad. You know, and it's hard for me to say as an adult, you know, say that I can't really take care of myself in those states, but it's true. You know, I don't feel safe in myself, if you know what I mean. I can go for maybe 2, 3, 4 weeks, you know, in the real depths of struggling with mental health. You know, I can sort of deal with it to a certain degree. I can push myself through, but you know, sometimes they can last quite a long time. And it's a horrible thing. It kind of eats away at you over time, especially if you're trying to sort of raw dog kind of push through it. You know, I'm better than this kind of attitude towards it. You know, I need to do better. I need to, you know, and not really giving yourself much self-care. It can often lead you to a breaking point when you have quite severe depression. I can't recommend medications. I wouldn't be able to, because I don't know you. And I'm also not qualified to do so. So you should always consult a doctor. not a YouTuber, but ideally find somebody who understands the nuances of treating depression and anxiety in autistic people. John Winterholt says, I found sertraline helps my anxiety. Interesting. Well, there you go. Like, people differ very, very much with how they react to certain things, because, you know, as much as we can develop widespread things that help with a particular issue, it's not tailored to every single person's neurology, you know. So it can produce a range of different effects for a lot of different people. He takes sertraline as well. Certainly isn't a cure. No, and it doesn't erase it. That's one of the things, you know. I think, as I said, medication sort of, it dampens the lows and also dampens the highs, which can just do it enough for you to cope, if that makes sense, if you are really, really struggling. It definitely doesn't remove my depression and anxiety at all. It just kind of shifts it down, like maybe one severity scale, you know, where naturally I'm sitting around the high end of severe, you know. With medication and exercise and all of that stuff, I might find myself more in the moderate kind of range in terms of my symptoms. You take sertraline too, Minty Sash? That was the worst for me, you know. It just goes to show, like, recommendations, sort of individual recommendations for things, not always the best thing to go off. For me, sertraline just absolutely crippled me with anxiety. Gave me headaches, made me so fidgety and just awful. Made me feel gross. But there's a lot of people in here who found it to be the one for them.